Hi everyone. So today I am with Harsha, who had a shoulder pain, and it's been almost 10 months now that she had come to me 10 months back. So what was the case, Harsha, when you came to me? What were your complaints really?
So my right, which is my dominant side, was I had a frozen shoulder,
Right.
and I think I have possibly done everything I could in my capacity, from taking cortisol injection to doing physiotherapy. I mean, multiple therapists I went to, and then in fact an uncle of mine who was in the US told me, if there is chiropractic in India, why don't you go? And then somehow I chanced upon your Instagram video. A friend of mine actually saw it, and we said, let's do this. And I think I just put all my faith in you, and my right hand, which was stuck at, I think when I came to you,
And
you
what
said,
is the range like?
I don't even know, I was stuck at this,
Okay.
but now I'm here, and and in the sense there is no pain, I'm able to lift weight.
Yeah.
My life hasn't stopped in any way, in the sense I'm like, I do
think
everything.
that's more important,
Yeah,
right?
I drive, I exercise, I lift
Daily
weights.
activities are all
Yeah,
good.
so which has been like the
That's more important.
Yeah.
Absolutely.
And also I think I kind of look forward, I know it's painful, but I look forward to coming to your sessions because it's just not my shoulder.
Yeah.
I have a desk job.
Yeah.
So I do feel that, when I come and do this lightness in my neck,
Yes.
back.
You feel a overall light.
And I also feel, I don't know, maybe it is just that I have so much faith in you that I feel a spurt of energy, especially when you put a yank my ears at the end of it.
So there's a lot of energy exchange.
Yeah. So that is definitely
Okay.
a plus.
So before you came to me and you saw physiotherapist also, was surgery also option given to you?
I think everyone told me that the only way out for you is going to be surgery.
Okay.
But I somehow I didn't want to, I'm just too scared of hospital. So I was like, I don't want to go under the knife for this one.
Yeah.
So I was like, I will try what it takes and I'll stretch. And literally you were like the last attempt at, and saying that if this doesn't work, I will shut up and just go get the, get the under anesthesia, get the whatever surgery or the manipulation done. But I think.
Right. But again, even after surgery, you have to follow up with a lot of exercises. And
Nobody tells you that. You almost tells you that surgery is done, you will go back.
It's the ultimate solution, but that's not the case.
I mean, actually, you were the only one to tell me that. So.
Yeah, I mean, there is a lot of rehab that needs to be followed post-surgery also. And I always tell my patients that if you have to do that sort of exercises post-surgery also, in order to make sure that, your surgery is completely successful. So you might as well try these things before surgery and see what relief does it make or what kind of difference does it make. And I think in your case, we have already seen a good amount of range. Like, your activities are not limited.
Yeah.
You don't see anything that stops you from your daily life.
No,
right?
and also the thing is, even if some days I get a pain,
Yeah.
it's very temporary. Like,
Yeah.
with a little bit of exercise, stretching,
Absolutely.
the pain also eases out.
So can you just show us the range right now? Like, where are we right now in terms of? Okay. So it's like just the end range, which is a little limited.
Yeah.
Yes.
And then on all sides, I'm able to
Move the shoulder in. So this is how spinal manipulation and shoulder mobilization works. It's just about if the consistency is done in the right way. So I have a lot of patients who actually kind of get scared in the first session because of course it is a little painful, let me tell you. But then post session, the shoulder that gets free and the range that comes up, I think it's okay to kind of undergo that session and of course continue the therapy. And I mean, Harsha has been following with this therapy from November. Of course, now we do much lesser sessions, but now we just kind of ensure that we are not going back to the range. So we just maintain the range. That's our target basically, and ensure that there is no pain at all or it is at minimum. So that's where our therapy is now aimed at. And thank you so much, Harsha, for talking.
Thank you, doctor. I can't thank you more than I can't thank you enough for.
Thank you so much. Yes.